Over 50% of fluoroquinolone absorption can be lost when you drink a glass of milk. Yeah, that's crazy, right? But your antibiotic might be completely neutralized just by pairing it with calcium, magnesium, or iron. This is due to a pharmacological phenomenon called chelation. It's when a drug binds to the metal ions and forms a complex that your body just can't absorb. And so this is super critical for some drugs like tetracyclines and fluoroquinolones. So let's dive into this question. We got a 25-year-old man, recent travel history to India, begins treatment for enteric fever with ciprofloxacin. However, he starts taking calcium carbonate for gastric reflux. Later, his fever persists. What's happening? Well, it's a reduced bioavailability due to the interaction. Ciprofloxacin, like your tetracyclines, binds polyvalent cations like calcium in the gut, forming non-absorbable chelates, decreasing absorption and decreasing the effectiveness of that ciprofloxacin therapy. So it's not a resistance that's developing, especially not as it's presenting suddenly in like 1 week. So that would not be the answer. Drug-induced liver injury, that's ciprofloxacin is not hepatotoxic. If anything, you'd see GI upset. Enhanced renal clearance doesn't change significantly with calcium. Chelation happens actually before the absorption takes place. So it's actually not absorption related. Poor patient compliance, so that's not the answer. So here are the key effects, key features. Tetracyclines, they bind metals to iron, calcium, magnesium, aluminum. So you might also see this if somebody's taking like acne medicine, like a doxycycline, and then they start consuming iron, then the effect is going to decrease for the same exact reason. The chelation leads to poor GI absorption, causing the decreased effect. If you want to get a science fact or question daily, then like and subscribe.